Naruvi Hospitals, promoted by the Sanko Foundation, is the brainchild of the founder-chairman Dr. G.V. Sampath. Belonging to Vellore, the medical hub of India, Dr. Sampath's vision to create a medical destination for the people of Vellore in particular and others from India at large and also overseas resulted in the establishment of a hospital here, a real crown jewel in the field of healthcare. Large numbers of people belonging to Vellore and the surrounding districts have been known to travel to Chennai and Bengaluru, both nearly 200 kilometers away from Vellore, seeking medical care due to the dearth of facilities and the hardships faced by the locals to access available services. As per the vision of the chairman, the best in healthcare, both in terms of medical and nursing professionals as well as sophistication, were infused into the institution, making sure that patient affordability was addressed at all times. Less than a month after Naruvi Hospitals opened its doors to the public, the second wave of COVID loomed large as life. We took on the challenge and quickly rose to the occasion, catering to the local population and some from outstation as well, adding close to 40 critical care beds and over 200 ward beds to the COVID care pool. Much as it was hard for a 1-month-old hospital to handle such large volumes of very sick patients, Naruvi Hospitals was able to contribute significantly in our country's efforts to save people from the disastrous end that COVID was driving people to. Naruvi Hospitals is positioned as a high-end tertiary care center. Our focus on ethics, transparency, patient satisfaction, and an academic outlook in everything we do ensures that doctors, nurses, and others in the care team are performing at their conscientious best to not only treat patients' ailments, but also to make them happy overall when they leave our hospital. We have tied up with the Henry Ford Health System, HFHS, based out of Michigan State in the United States of America. HFHS is one of the old and leading healthcare delivery systems in Midwestern America. The main aim of this tie-up is to have constant transfer of knowledge and to get access to the time-tested practices they have been following for decades, which ultimately translated to patient care. Naruvi Hospitals is a completely paperless and filmless hospital. The Naruvi philosophy of care is embodied by our motto, Fragrance of Care. The doctors in Naruvi are largely trained in the best of medical institutes in India and come with years of rich experience in their fields of expertise. With the philosophy and its pallbearers, the medical and nursing professionals, the high-end equipment, and the building infrastructure complete the holistic picture of Fragrance of Care. The hospital is 475 bedded with a 25% critical care bed count. Naruvi Hospitals boasts of an over 5 lakh square foot building spanning 14 levels. The building is completely air-conditioned, conforming to ASHRAE standards with zone-specific air conditioning to reduce cross-infection between different care areas. Our laundry is 100% barrier washed. We have a top-of-the-line sterilization department with machines with 95% water-saving machines, saving up to 300 liters of water every running hour. We have all the major medical and surgical specialties. There are 16 modular operation theatres with laminar airflow. All the equipment in the ICUs and OTs are pendant mount to avoid clutter on the floor. All the departments are equipped to the most modern standards with the best and latest equipment so as to be able to provide the best end-to-end treatment to our patients. State-of-the-art cardiac cath labs, the latest robotic hybrid OT, ECMO, interventional pulmonology, high-end orthopedics, general and bariatric surgery, epilepsy monitoring unit with robot-guided epilepsy surgery, neuro monitoring, navigation, the latest lithotripter, urology laser are just some of the arrows in our quiver. Our primary focus, though being the local Vellore people and Indians at large, we are working towards attracting overseas patients as well. We have started an office in North Sudan in Khartoum. We're in the process of tying up with the governments of Oman and Seychelles as well. In all, Naruvi Hospitals is more than a hospital. It is an experience.
Good morning to all. I apologize for this delay in start of the program because due to some technical issues, I'm not yet being able to see all the panelists on the screen.
Can you see, ma'am? It's me, Nagarajan.
I can see Dr. Nagarajan, Dr. Sonia, but not Dr. Murugeshan.
Yeah, I have shared my video, but for some reason it's showing a blank screen.
The Hindu team, can you help? Unfortunately, there have been quite a few technical glitches since morning, and that's why this delay. Will you be able to share your presentation, Dr. Murugeshan?
Yeah, I'll start sharing them.
No, then I'll
Someone we can set the context and start. By the time I think Murugesh sir can put the PPT on the screen. I think you can set the context, ma'am, and you can start.
Okay, right.
Thank you, ma'am.
I sincerely apologize for the delay. On behalf of the Hindu, I welcome all our panelists and participants to the 11th episode of the 15-part webinar series on Healthy India, Happy India. The initiative is presented in collaboration with Naruvi Hospitals, Vellore, to inspire and promote well-being. Today's focus is on child health and development, and our three panelists will speak on physical and mental nurturing in our children from infancy to adolescence. We all understand and also know to raise a healthy child, we as parents and family need to prioritize their nutrition, physical activity, and sleep. Children have to be taken for regular checkups and vaccinations and provided with a caring and supportive environment, which is crucial for their mental and emotional health. From their first smiles to their first steps and beyond, each stage is a milestone, and each experience gives out a gamut of emotions. Good positive parenting is a must for raising a healthy child. To throw more light on today's topic, I will first invite Dr. Murugeshan, a assistant professor in the Department of Neonatology at JIPMER, Puducherry. After completing his MBBS from Madras Medical College, he did MD Pediatrics from Maulana Azad Medical College, Delhi, and followed it up with the DM in Neonatology from Lady Hardinge Medical College, Delhi. He is the 2020 recipient of PC Srivastava Memorial Award in Neonatology and has been a national trainer for the facility-based newborn care and point of care in ultrasonography. He has more than he has more than 2 dozen publications to his credit, and he will give a presentation on maternal and the newborn health. So welcome and over to you, Dr. Murugeshan.
Yeah, thank you very much for the kind introduction. So at the outset, let me thank the Hindu team and the Naruvi team for having made this event possible. And having said that, since we are already delayed by a few minutes, let me start my presentation. So it will be a very small and brief presentation because I assume that there are participants who need their queries to be answered also. So we save the time for those. So I'm going to discuss about a healthy newborn and what a maternal and child health means to a normal pregnancy and what should be taken care by any mother or any parent for the well-being of their newborn baby. So the overview I'm going to speak about is what is normal pregnancy and what are the facts and care during normal pregnancy and what is a normal newborn and what should be done for a normal newborn and when should we be worried and some take-home messages. So obviously we cannot go into the finer aspects of each and every aspect regarding this. So we'll touch upon the overview of all these things. So what is normal pregnancy? We are in an era of AI and information overload. So we need to know that normal pregnancy is actually a uneventful period, and it is mostly it is a healthy period. So it is the phase where a fetus is developing into a newborn baby. So as you can see, so something which is as small as this, as the size of a raspberry, is going to blossom into a beautiful baby over a period of 9 months. So 90% of the pregnancies are uneventful. That means 90% of pregnancies, there are no problems to the mother or the baby. And approximately 88% of the babies, according to Indian statistics, are born at full term, right? So they are born at the end of 9 months. So even some babies who are born before 9 months turn out to be totally fine. That's why I said 90% pregnancies eventually end up with being a healthy mother and a healthy baby. So since 90% of the time it is uneventful, we need to do what should we do to stay healthy. It means both for the mother and the baby. So we'll cover a little bit of both baby and the mother. So before I tell about care during normal pregnancy, what I would like to know, what I would like you all to know is the fact that there is something called Mother and Child Protection Card, which has been made available freely online for anybody to see. So it is, I would say, a very underused tool and a very valuable tool. It has a lot of information. So there are two guides. If you just search Mother and Child Protection Card in Google, you will find these two resources. So one is the Mother and Child Protection Card, also known as the MCP card. The other is the MCP guidebook. So they have very pictorial depiction of what is to be done, what not to be done. And it is a must know, even for many, I would say, medical professionals, even for many nurses, they find this information very, very, very valuable. So I find no reason why any other parent or mother should, not make use of this resource. So just to show you, this is how, this is just a page from the document. It gives a pictorial depiction of, what should be done in each of the month of pregnancy. So ANC is antenatal care, what should be done, and how many registrations or how many checkups are minimum, and what all should be done in each of these visits, right? So for example, you can see the vaccination being administered at the second and fourth visit, right? So I will just summarize into a quick single slide. So we call the phases of pregnancy as trimesters. So anything up to 12 weeks is called trimester 1 or first trimester. 12 weeks to 28 weeks of pregnancy is trimester 2. And after that, it is trimester 3. So what is common to all of these periods is mother needs extra nutrition, somewhere around 300 to 400 calories of energy and some extra protein also during all these three uh, during this period of pregnancy. Of course, in first trimester, not much additional is needed, but second and third trimester, extra nutrition is definitely needed. So what should be done in the first 12 weeks is confirmation of the pregnancy, take some supplements, iron, folic acid, and calcium. In fact, folic acid should be taken by anybody who is planning pregnancy. Any women of childbearing age group who is planning pregnancy, they should start taking it even before pregnancy, right? So when somebody is planning for pregnancy, folic acid 5 mg should be started right away. And one scan is advised to confirm the pregnancy, and vaccine. Usually, it is the tetanus toxoid vaccine or the TD vaccine, which is tetanus and diphtheria vaccine. So what should be checked is weight, height, and some blood tests, which are basic like thyroid, hemoglobin, sugar, and also BP. So this is what somebody is expected to do in the first 12 weeks of pregnancy. So coming to after 12 weeks, so your doctor might want you to make sure that you feel the fetal movements. Somewhere around 16 weeks or 20 weeks, you might start feeling fetal movements. So there is something called as a level 2 scan where all the organs of your baby are checked and ensured that they are all fine. And the fetal movements and monitoring of all these things like weight, height, like BP and sugar, they are all checked in every visit, right? And third trimester again, so the fetal movement surveillance is ongoing. So there is something called count to 10, which mothers are usually told to do. So it is nothing but counting the fetal movements or kicks at a fixed time in a day. It may be in the early morning or in the night time. So at the same time, preferably daily after lying down in the lateral position. So count how much time is elapsed while you perceive 10 fetal movements, right? Or fetal kicks. So usually we will be able to, or any mother would be able to feel 10 kicks in a matter of minutes, right? So if there is no perception of fetal movements, like 10 kicks in 2 hours, then it's something abnormal, right? So that's why we say choose a perfect position, that is lateral position, and a perfect time where you are able to perceive the movements perfectly. So usually in 2 hours, 10 movements are easily felt, right? If needed, a growth monitoring scan is done. And of course, the same monitoring as before, the weight, height, and sugar and BP will be checked in the third trimester as well. So this is in a nutshell what anybody needs to be aware of in a normal pregnancy, right? Okay. So having told about normal pregnancy, let me tell about a normal newborn, right? So a normal newborn is one where the baby weighs usually about 2.5 kg and is born after 37 weeks or 9 months. Usually they don't have any problems at birth. So what's imperative is to keep the baby and mother together. So that is the best treatment or the best care we can give to the baby and mother. So normal pregnancy, keep the baby and mother together. So they need only three things: breastfeeding, immunization, and an examination and discharge to see that they are otherwise doing well. So 80% of the pregnancies fall in this category, right? So the mother is fine, baby is fine. So 80% of the time this happens. Unfortunately, in 20% of the times, babies may be born low birth weight, may be born premature, there may be some problems at birth. They might need additional care, but all of them will benefit from breastfeeding, immunization, and some examination before discharge, right? So this is to know what is normal and what is abnormal. So having told that 80% of the time babies are normal, so they require only something called as essential newborn care or basic newborn care. What is needed is they need warmth, they need feeding, which is breastfeeding, and the mother needs to be told about hygiene for herself and the baby, right? So essential newborn care, this is what it means. So how are we going to take care of this essential newborn care? So warmth, the best way of providing warmth to a baby is to hold the baby skin to skin. This automatically happens when the mother is breastfeeding. So the room temperature should be around 26 to 28 degrees Celsius. Have an appropriate clothing for the baby, mostly a cap, a shirt, and some mittens and socks. Right? So in colder areas, they may need extra sweaters and extra layers of clothing. And bathe the baby only with lukewarm water, right? And it is not always necessary to bathe the baby daily, especially if they are weighing less than 2.5 kg, right? So a simple lukewarm water, you can take simple lukewarm water in a warm cloth and just rub the skin of the baby if it is very cold, right? I mean, if the temperature is very low. So why the baby needs warmth is because inside the mother's womb, baby is bathed in warm fluid, right? So the mother's temperature is somewhere around 37 degrees, and suddenly a newborn is born where the outside temperature, even if it is hot, the outside temperature is 30. So that is a relatively cooler environment for the baby. So warmth is very, very important, right? So warmth. So once you take care of warmth, everything else will fall in place, right? So warm baby will be more interested to breastfeed, right? So many mothers have problems with breastfeeding. So one of the major things to ensure is that the baby is warm and comfortable before latching the baby, right? So breastfeeding should be on demand. So whenever the baby needs, correct attachment and positioning are very important right from birth. And there is a policy called zero separation. So in babies and mothers who are totally fine, we don't have to separate them. They can be together throughout the time. Unless there are special needs for mother or baby, we don't have to separate the baby and mother. So hygiene, so clean hands, clean baby. Every mother should be taught to wash her hands or do hand hygiene before touching the baby, and how to take care of the baby's skin, how to change the baby's diaper. So these are all some basic things they need. Usually baby skin care some moisturizer like coconut oil is more than enough, right? Okay, so breastfeeding, not after some time, not after an hour, not after half an hour. It is immediately after delivery, especially if both baby and mother are fine. So usually babies are put on the mother's abdomen and then on the mother's breast. So this is very, very important because only those babies who are able to feed in the first hour of life or immediately after delivery, only those mothers feel comfortable feeding the babies even after 6 months of age, right? So the initial 1 hour is very, very important because the baby is more receptive to breastfeeding in the first 1 hour. So it is important for every mother to demand that the first 1 hour I need to be with the baby. And also as healthcare professionals, it is important for each one of us to make sure that you and your baby are together in the first 1 hour of life. So after feeding and warm, what else do we need to take care of the baby? So immunization is given at birth. So there are 3 vaccines like BCG, hepatitis B, and OPV. BCG is for tuberculosis. Hepatitis B is for, as the name suggests, hepatitis B, something which can cause jaundice, and a polio vaccine. Right? These 3 are given at birth. Usually, normal babies lose some weight and regain their birth weight after the first week of life. So that is totally fine to lose some weight in the beginning. So breastfed baby will pass urine 6 to 8 times a day and gains weight 30 to 40 grams a day. So this is what is called a normal newborn baby. So they lose some weight but gain weight later. And there is something called newborn screening, right? So before discharge, what is usually done is baby's vision, baby's hearing, these both are checked because newborn babies should be able to hear, should be able to see. And there is something called hip test. So the hips will be tested whether they are in alignment or not. Because especially for some babies who are not in a position with head down. So some babies are in what we call as breech presentation. So instead of their head being down inside the uterus, so their head is up. So these babies are likely to have problems with the hip. So a hip test is done and the saturation is done before discharge. And a jaundice assessment is done. Usually it is done by looking at the baby under naked eye or using something called as bilirubinometer, which is a electronic equipment. So these tests do not need any blood sampling or any additional uh, test for the baby. So what test should be done is the thyroid test because uh, hypothyroidism or low levels of thyroid hormone is something which is very common. At least 1 in 2,000 babies have this, and it is treatable. So it is mandatory for every newborn. So there are other tests which are optional based on the area where you reside, right? So, but thyroid test is mandatory. So only one blood test is needed for any healthy baby, which is the thyroid test, and rest all assessments can be done by the bedside of the baby. So this will be done before the baby is discharged. And before discharge, so what will be done is baby has to be feeding well. Baby should have passed urine and stool or motion, which is what we call a stool. And immunization should have been complete and this newborn screening should have been complete. So once these are done, a baby is fit for discharge. And at the same time, there are some prerequisites for the mother. So usually mothers should have avoided urine and they don't have any bleeding and they are able to have breastfeed their babies. So then they are also considered fit to go home with the baby, right? So before going home, again they need to know what is normal, what is abnormal, right? So any baby who's not feeding, any baby whose color is not looking pink, any baby who has decreased activity, any baby who is having difficulty breathing or fever or not passing adequate urine, these are abnormal. So there are some things which may sound abnormal but are usually normal, like a fussy baby. So babies are known to be very irritable, right? That is because inside the mother's womb they are well protected. Suddenly outside they are exposed to so much stimuli. So they are passing stool and it is often very uncomfortable to them. So they often cry, So these are all very normal. And as long as the baby is active and feeding and gaining weight, so these are all okay. Passing more stools than normal, vomiting after each feed. So these are usually normal as long as the baby is active and gaining weight. So before discharge, every mother or every parent should know about how to take care of the baby's temperature, how to position the baby because inside the mother's womb, baby is fully flexed. So the baby's hands, baby's legs, they are all fully flexed. So it is important to promote the same positioning outside the womb as well after the babies are born. So there are certain activities of the babies which every mother should know: how to breastfeed, how to change the diaper of the baby, how to do skincare. Usually some emollient like coconut oil is more than enough, and how to do hand hygiene and keep the hands clean. And when to come to the hospital, what is normal and abnormal. We just discuss what is normal, what is abnormal. And if the baby is normal, when to return back to the hospital is for the vaccination visits. So this is again from the MCP card or the Mother and Child Protection card. You can see after birth, there are vaccines at 1.5 months, 2.5 months, 3.5 months, 9 months, 16 to 24 months, 5 to 6 years, 10 years, and 16 years, right? So in fact, the Mother and Child Protection card also has details about how to track the growth of children, how to see whether they are developing normally. So when some development is considered abnormal, right? So they are all depicted pictorially. So to conclude, I would say normal pregnancy is usually uneventful, as we have seen in 90% of the cases. What parents or mothers need to know is what is normal and what is abnormal, and what is essential newborn care. Essential newborn care is the birth rate of every newborn baby. So they should receive three things, which are breastfeeding, warmth, and hygiene, right? So this is called essential newborn care. And vaccination, what is given at birth and what to do later at 6 weeks, 10 weeks, and so on, right? So with that, I conclude my session. Thank you once again for the patient listening and the opportunity to present this topic.
Thank you, Dr. Murugesan, for your talk. And unfortunately, we are still not able to see you on the screen. I would request you to rectify the error while the other speakers give their presentations. We now move on to our next speaker, Dr. Sonia Mary Curian, Head of Pediatrics Department at Naruvi, Vellore. She has over 20 years experience in pediatrics and neonatology. Dr. Sonia did her diploma in allergy asthma from Christian Medical College, Vellore. She also did her postgraduate training in child health at Kasturba Medical College, Mangalore, and DNB in pediatrics from Kottayam Medical College, Kerala. Dr. Sonia has briefly worked in the UK, where she also completed her MRCP. Her areas of interest include childhood nutrition and lactation. She will talk on immunization, nutrition, and health in early childhood from 1 to 10 years. Welcome, Dr. Sonia.
Good morning. Thank you for that introduction. I'll just share my slides. Okay, so today we will talk about the raising a healthy child after the newborn period, what parents should do. So every child is unique. Every child is unique, and the parents have an immense influence on the child's development. So the early childhood development covers physical, mental, social, psychological, and the socio-economic influences the child is exposed to. Our job as parents, pediatricians, is to ensure that the child has good health, adequate nutrition. The caregivers have responsive caregiving techniques. The child should be having good security, safety, and opportunities for early learning. This nurturing care from
Excuse me, ma'am, your PPT has not started. I think it's the wrong.
You cannot
slide.
see? Sorry.
No.
Just start again then. Can you see now?
Yeah, now it's.
So this early childhood development covers good health, adequate nutrition, responsive caregiving, safety, security, and opportunities for early learning. So this is provided by parents, the family, extended family, community, other services, the whole the socio-political climate, all affects the child's development. So as Dr. Murugesan spoke about the visits, This good health is a state of complete physical, mental, social well-being. And during the visits to the hospital, the first visit is the well baby visit at less than 1 week, and the other visits for immunization. During these visits, health issues which concern the parents and which affects the child will be discussed, and assessment is done about the child's growth, development, and how the baby is, and immunization is given. It's important to check eyes by 3 years, and the orodental care by 9 to 12 months, then annually. Anemia, rickets, and other micronutrient deficiencies should also be looked for. All these help to prevent problems later, including immunization, which helps to get immunity against certain diseases. The MCP card and other educational materials will ensure that parents can understand and keep coming for the further visits. Adequate nutrition. After the breastfeeding, 6 months exclusive breastfeeding, till 2 years, breastfeeding should be continued. Along with breastfeeding, at 6 months, the other 7 food groups have to be introduced. This includes vitamin A rich fruits and vegetables, other fruits, vegetables, fleshy foods like meats, poultry, liver, organ meats, legumes, nuts, eggs, grains, roots, tubers, and dairy products. The plate, half the plate should have vegetables and fruits. 1/4 of the plate should have cereal items like rice, millets, and 1/4 should have proteins like pulses, eggs, and nuts. The family should eat together, and the child should not be distracted while eating. And milk also, as curd, can be given in each meal. Next we come to the unhealthy eating habits. Sweetened beverages, junk food, eating in very large proportions should be discouraged. Child should be encouraged to play. The first 1 to 3 years, they should play outside for a longer period. After the 3-year period, once they join school, at least 1 hour of physical activity the child should have. This will prevent obesity and improve the muscle strength, bone strength, joint strength, and prevent chronic illnesses later on like high blood pressure and diabetes. And the child feels happy and increases their confidence. The child is monitored during each visit, the height, weight, head circumference, and plotted on a growth chart. If there is any problems in this, the doctor will advise how to improve the child's nutrition and growth. Developmental monitoring. 43% of children under 5 years may not develop according to the developmental milestones. So the early childhood development means age-appropriate development, which has to be tracked during each visit, positive parenting practices, and early identification of warning signs. The MCP card, which Dr. Murugesan mentioned, also will help in this. It has certain pages which have age-wise development. So the green color is what the child should do, red color is warning signs, and the blue color is parenting tips on how the child can be made to develop that stage. Missed milestones. At 2.5 months, baby is not looking at the face and smiling. At 4 to 6 months, child is not tracking, not looking at objects, not turning to sound. Child is not making noises by 6 months. Child is not walking at 18 months and not talking by 2 years. All these are worrying and needs to be identified and treated. Safety and security. The child should be protected from all hazards. The child should be provided a safe environment both in the house and outside to play and develop. And we should protect from severe stressful situations. These which will result in injury, neglect, and maltreatment. Child should be taught good touch and bad touch. Good touch is child feels comfortable and involves holding maybe the hand, and child should feel happy. But bad touch is child feels uncomfortable and involves touching the private areas, and this should be reported to the parents or a guardian, and appropriate measures have to be taken. Responsive care. The child should, responsive care means we have to respond to the child's needs and cues. We have to be attentive, consistent, and predictable as parents. So each age group, with play and communication, we can assess what the child, we can talk to the child will talk back to us. If the child wants to play simple household things like the pots and pans, the spoons, all are helpful for play, and this helps the child to discover and develop. And communication should be there throughout the child, which is age appropriate. Adult and child relationships that comprises of responsive, attentive, back and forth interactions like serve and return helps to develop the child's skills. The 5 pillars of positive parenting includes safe and secure loving environment, positive learning environment, positive discipline, having reasonable expectations for the child, and the parent also should take care of themselves so that they can take care of the child. Screen time, less than 2 years, we do not advise any screen time because during this period the brain is growing, the nerves are growing, and if the child is exposed to the screen, these developments do not take place, and the child will have issues of they will have reduced attention span, they will not be able to speak, there will be delay in speech and communication skills, and later on physical health, they will have obesity, eye strain, and mentally they will be aggressive and they have poor concentration, and this will result in poor academic performance and social anxiety. How to prevent media addiction? Parents are the best role models for their children. If we use screen excessively, the child will also watch and learn. So we also have to reduce, we have to encourage reading habits, walking in the nearest park, and encourage physical activity. So positive habits include good sleep hygiene, toilet training, early learning so that the child has appropriate play and toys, and communication, reading together. These are some of the tips which will help to have a healthy child. Thank you.
Thank you, Dr. Sonia, for that comprehensive talk. Before we move on to our final speaker, I would request our attendees to start posting their questions for the panelists. The QA box is open. Our final speaker, Dr. V. Nagarajan, consultant pediatrician at Naruvi Hospital, Vellore. He's an MBBS and MD from Chengalpet Medical College, and he has been with the Naruvi for the last 5 years. And prior to that, he worked as an assistant professor and pediatric consultant in other private medical colleges. His presentation deals with the adolescence years. Welcome, Dr. Nagarajan.
Thank you, ma'am. Thank you for the introduction. So I will be talking regarding how to raise a healthy adolescent. First, what is an adolescent? The age group of 10 to 19 years where they are transitioning from childhood to adult. They cannot be simply termed as a bigger children or a smaller adult. It's a tricky phase of life where they are supposed to transition to a confident adult. It's also a phase of rebellion because they are transitioning from every parental advice to take an individual decision. So it's a phase of rebellion. They will seek autonomy. They will test their boundaries with the parent, with the teachers, and they will tend to develop an individual identity. There are certain risky behaviors also. They may be self-forming or violent behaviors, which are abnormal behaviors, where they may have to address. So the health will be addressed, as Madam has pointed out, the health will be addressed in 5 dimensions. In adolescent age group also, physical health, mental and emotional health, social development, academic growth, and moral and character development. The ultimate aim is for an adolescent to grow into an independent, confident young people. Before going to how to raise an healthy adolescent, we will look into overall picture. The common mortality as provided by World Health Organization among these age groups, it varies according to the region where they grow up, either in a developing country or high-income countries. This data pertains to our own data also, because India is a complex region with both both poor people and rich people are there. So among the global mortality among adolescents, road injury, road traffic accidents are a common scenario. And other things like interpersonal violence, it varies according to sex of the child also. It depends male or female. And among the morbidity, those things which are more prevalent but doesn't cause the death of the child is there are certain things which anemia is very common. And the mental and emotional problems are very common. Anxiety, depression, particularly among females, are very common. Even among males also, these things are very common. So adolescents are constantly being neglected because the parents will think adolescents will overcome their own problems by themselves, and there is a common lack of awareness to address the adolescent. And many times parents and teachers, they will have a stigma whether to reach professional help. There is a stigma attached to it. So regarding physical health, again, this is an extension of what ma'am already told, how to raise a healthy child. So nutrition should be well balanced, and there's a relatively there is a extensive habit of ordering online, which should be monitored and it should be restricted. There should be limitation of junk foods and sugary drinks. Sleep, at least 8 to 10 hours of sleep, and it is a common habit because of the pubertal thing. It is very common for an adolescent to sleep a little extra time, and that is pretty normal. It is physiological. No need to worry regarding that. And absolutely, obesity is becoming a common problem. So exercise for 1 hour, active physical exercise for 1 hour is recommended for every adolescent. Hygiene should be advised by the parents, and a regular healthy checkups by doctor visits where we can pick up so many problems. As I told you, we will pick up anemia, we will pick up overweight and obesity, and we will address any vaccine demands such as Tdap, DPT booster by around the age of 10 years, and HPV, human papilloma virus vaccination, which is meant to prevent cervical cancer among girl childs. So regarding the mental and emotional aspects of an adolescence, their mental and emotional problems are very common. So what we should do to bring up a healthy adolescent? So we should basically behave as a parent, we should basically behave as a friend as well. So we should listen to the problems without any judgments. We should address their feelings, worries, and we should address their friendships, how things are going regarding their friendships. We should let them solve their own problems with overall guidance. We should not interfere in every aspect of it. And we should promote the self-esteem. We should compliment their effort. We should compliment the character and kindness more than getting marks, getting grades, and looks. We should also help them to how to tackle a stressful situation. We should teach ways to cope, like deep breathing, journaling, and taking breaks, and other things. Regarding social development, without intervening too much, we should also have a look about the social aspect of each and every adolescent. We can advise what makes a good friend and how to handle peer pressure by our own experience. And we should, nowadays it becoming a digital era. So online safety is of serious concern, because apart from family, apart from school, now most of the adolescents spend the time through online, digital online. So we should have that safety checked up as well. So set age appropriate rules for internet use, which is available to in every apps as well. Talk openly what they are seeing online, and you should tell them why you are restricting the internet use, and you should tell each and every adolescent why you are setting limits to it. Teach them to set and respect personal boundaries, both physical, emotional, and digital, from parents as well as others. Academic growth is of important concern. Yeah, every parent will want the child to be shine very much, but not at the expense of their own emotional and social pressures. So if we should support learning, like arranging a quiet space for study, help with the homework when needed, and stay in touch with teachers. And all of a sudden, many times we used to see they are all of a sudden by around +1 or +2 they are switching out to hostel, and children are finding it very difficult to cope with their sudden increase in the academic pressures. Many children are turning up with severe anxiety and depression because of academic pressures. So school success is important, but so also is joy. Encourage some hobbies, encourage some rest and play. They should not be physically becoming more obese, and should be concerned only regarding academic growth. Moral and character development. So we should lead by example. As a parent, we should lead by example. We should show kindness, honesty, and responsibility, respect in your own action. A healthy family relationship will bring up a healthy adolescent. Talk about values. You should discuss real life situation and ask what is going on, what will you do in the same scenario. So we will address some very important questions which have been constantly asked in our regular adolescent clinics. How to limit a digital viewing for an adolescent child? They are not going to respect each and every one of your rules, but at the most we can try it. We can absolutely, it is possible to limit digital viewing in an adolescent by a parent. It is super important, but it is entirely possible. We should have some clear rules. We should have some open conversation between a parent, and we should also give some healthy alternative to them. So we should set them a clear, consistent rules. There should be 1 to 2 hours of non-school screen time per day. You can give some allowance. And certain areas, absolutely, there should not be screen. No devices at the dinner table, in bedrooms at night during family time. We can make some, as a family, we can see some movie together, and we can share some ideas in between them. So when a parent keeps on scrolling at the mobile, they will do the same. So we can, as I have told you, we can use some parental controls without spying, and explain why we are using those tools to protect them, not to control them. We can encourage some meaningful use. Promote now the media has been expanded so much. It can be actually used for some meaningful learning. Promote tech for learning, creativity, connection over mindless scrolling and games. Particularly, some shorts are coming up. They are simply scrolling through everything without a proper guide. They are simply without any proper parental guidance. They will simply scroll through each and some random videos, which is harmful for the emotional and mental aspect, and they are not learning much. So watch shows and plays game together. Sometimes it'll become a shared experience. As I told you, we should offer some real world alternatives. If I am not getting not able to see phone or TV, what I'm going to do? So you should offer some sports activity like swimming, playing shuttle, art, reading, music, and social events like going outside together, outings and family nights. I must have told you, talk openly why you are doing everything. So adolescents, they may act like we don't need parents' advice, but they still need our love, attention, and boundaries, even if they act like they don't. We should be like their anchor, even they start to sail on their own. Basically, I have told you, a healthy family brings up a healthy adolescent. We should, as a parent, we should invest our time. We should listen to them, be a friend, but set boundaries and be a role model. So bringing up a healthy child on the whole, it's not only a family aspects. There is a whole saying, it takes up an entire village to bring a single child. So the friends are involved. For a healthy child, friends are involved, the families are involved, the nearby community is involved, and the wider society as a whole is involved. So out of everyone interest, so it is of everyone interest to bring a healthy child, because they are our potential leaders, and they tend to form a healthy child will bring up a strong, healthy leaders and economically good persons. Yeah, thank you. Thank you for the topic.
Thank you, Dr. Nagarajan, and thank you, panelists, for highlighting, the ways to raise a healthy child in different age groups and at different stages. And as a mother myself, I've always wondered whether there is really a blueprint to raise a child, because, as we commonly say, to each his own, within quotes, child. I'll start with you, Dr. Nagarajan. Adolescents, we all generally there's a feeling that it is the most difficult phase to handle, both by the parents and the children. Because, as parents, when we try to guide them, it is some kind of interference and irritation. They will look at it. Or when we try to give them space, we really do not know what they're up to and what they are doing. So, and a lot of things that you have said are very important and relevant, but are often difficult to execute also. So how would could you just touch on that little bit of that psychological part of, how to deal with this, what we call the troublesome teen years?
Yeah, there is no single blueprint for every child. Every child is unique. It depends how they grow along, and what their parents are, and what their parents' educations are. So it's basically to provide a good opportunity for an adolescent to speak freely. For that, they have to provide a nice opportunity. They should behave as a friends. And if they are if any parent is finding it difficult, despite all their good attempts, if they are finding it difficult, it is valid to get a professional help, so that we can guide them.
I'm glad, Dr. Murugeshan, you're back on the screen. There's a question, says, I'm 5th month pregnant and I was diagnosed to have gestational diabetes, 172 mg/dl. So will gestational pregnancy affect my baby's physical and mental health? I'm worried about this. There's a question. Yeah.
Okay, so this is a very relevant question in this era. because diabetes and hypertension are two very common illnesses which complicate pregnancy. But as long as it has been picked up and you are in the regular follow, and it is not going to, if it is under control, especially, it is not going to affect the baby very much. So, having said that, we need to know when it will affect the baby. For example, if it is uncontrolled or if you have diabetes, well before your pregnancy, those are the times where it will affect the baby. So it's only fifth month. So fifth month diabetes usually doesn't. By the time fifth month it's reached, your baby's organs are already well developed. So you are not going to experience major setbacks. But having said that, it would be nice to have a close watch, and of course you don't have to worry about it. So because we don't know whether diabetes affects pregnancy or not, but worry definitely affects pregnancy. So you need to take care of your own health, so mental health as well. So just follow frequently for your diabetes and take care of your own mental well-being. That would be the best.
And what about the pregnancy-induced diabetes and hypertension?
Yeah, so there is some difference as to how diabetes and pregnancy, diabetes and hypertension affect the child. So one is diabetes first diagnosed after pregnancy, or first hypertension first diagnosed after pregnancy. Other thing is a mother who is already having diabetes and pregnancy getting pregnant. Obviously, the complications are more in a mother who already has diabetes and hypertension who is getting pregnant. But in those who have become pregnant and having diabetes or diabetes or hypertension for the first time in pregnancy, their side effects are much more lesser. So with monitoring, they can be managed successfully to full-term pregnancy without any complications. So like 20 to 25% of these kids will have what is called as low birth weight. So even that is not a major issue these days. And it depends on your frequent follow-ups. If it is controlled, you are likely to have a good outcome as anybody else. If it is uncontrolled, there are ways to control it and still give a good outcome. So it depends on multiple other factors also.
Dr. Sonia, like you have talked about this very vulnerable age group, 1 to 10 years, when most of the children are, they're moody, they're poor eaters, they're throwing up, they're falling ill frequently. So there are a couple of questions on diet, like Mr. Srinivasan says, my 1.5-year baby is not eating properly, how to handle and what to feed him. Mr. P. Venkatraman says, my daughter is 9 years old and how to make her eat fruits and vegetables. So I think you need to reiterate a couple of your points on diet.
Yes. So we say, can you hear me?
Yes, yes.
So we say that the child should be weaned from 6 months. So when the child is introduced to a variety of foods early on, they slowly develop the taste and they're a better eater later on because they have experienced different foods. I've shown you the 7 food groups. All food groups can be introduced one by one, making sure the child has no allergy. But once the child has reached 1 year, the picky eating starts. So for picky eating, again, as parents, we have to set an example. They are watching us. The children are watching what we are eating, how we are eating. So if we switch off the screen and the TV, then they can watch and learn from us. So one is we have to eat healthy and we have to sit together as a family and eat, and the child has to learn by watching. We have to get rid of like bottle feeding and too much milk. Children who drink a lot of milk, they also are very fussy. They don't feel hungry and they don't eat correctly. So we have to make sure that there is a balanced diet. Half the plate should be rainbow colored vegetables, some fruits, as I said, some cereal like the rice or millets, and proteins. All this helps the child to grow healthy and avoid deficiencies. Even at 9 years, children are being influenced by the screen, what they are watching. But as a family, we should avoid eating or ordering out much food. And during the week, we should have a plan. Weekdays, home food, fresh, well-cooked home food, and water, and during the weekends maybe eating out. But if the child has a habit of eating out food, they don't appreciate the home cooked food. So one is, as parents, examples, buying the right food at home and avoid temptations at home. And it's just as parents and children, we have to interact, communicate, and have a plan to eat. There is too much advertising for junk food, and that leads children the wrong way. But we have to be patient and consistent.
Yeah, I think we also after some point we can't just keep playing the blame game, and we have to maybe present in some tastier form or whatever, because children have sometimes very strong likes and dislikes.
Yes, yeah. Food should be attractive, colorful, and tasty, and the child will get used to what is the family taste. What they have grown up, they will eat as adults. So we have to be careful with what we give.
Dr. Nagarajan, how to manage children who have a habit of shouting and disrespecting adults? I mean, how do we manage them without scolding them?
Yeah, it's
That's
a
somebody's
bit
asking.
tricky. It's again, it's a bit tricky. Yeah. So everyone should have some mutual respect toward each other. So there is no point in beating the child. It will actually worsen the scenario. The child will take it as, you're going to beat me anyway. I'm going to follow my own plan. So there is absolutely no point in beating the child. And we should have a role model of thing in doing things. Nobody should even, the child is going to quickly pick up any swear words of beating. If the mom and parents are quarreling in front of them, going to do some swear words in front of them, so absolutely they should have a role model of themselves. So showing kindness to others is the first step by the parents to each other. And if they are going to set, if the child is going to shout anyway, we have to show some boundaries to them. They are going to restrict access to particular things without resorting into physical threat. So child will be given denied of certain things, certain comforts, like, yeah, you're not going to out today with us. So certain restriction, he may shout again, but need not worry too much. After a while the child is going to realize on its own. We will be denied a few gifts and something, so child will tend to overcome it. And better to talk to the child should be respected as an individual, and talk to them what is going on, what's your idea, what's your plan, and why we are restricting you. And child will absolutely will learn. Even during conversation, during OP period, the child will have a small look what I'm speaking as a doctor and advising the parents. The child will quickly pick it up. Yeah, they will realize absolutely that the important thing is to by the parents to talk to the child. Yeah, they will give you an absolute surprising feedback why they are doing it and how to overcome it. They will themselves provide the answer.
These days, the general impression is that parents are tending to be a little lenient towards children. Even school teachers are lenient towards children. So there has to be a little element of strict supervision and monitoring. Yeah. So, Dr. Sonia, maybe you could take this. Hemlata wants to know, how do I stop my baby's thumb sucking habit? And will it affect teeth alignment and jaw growth?
Unmuted. So the thumb sucking is a habit, and it is normal to a certain age group. A 1-year-old child or a small babies, they thumb suck as a security. They feel comfort by putting. But we have to see: is it because of hunger? Is it something that is disturbing them? So a child needs regular food, so that much hunger bit is treated. The thumb sucking child should not be blamed, because child gets afraid and again thumb sucks. So we have to just gently initially just pull out the thumb and just make them understand this is not right. But usually the children outgrow this once they are able to understand or console themselves. Any dental issues should be seen. As I said, from 9 months to 1 year, we should see the dentist, and they will also advise. Annual checkup is preventive care. It prevents problems from coming. So thumb sucking, it will be there for a few years. It is normal up to 1 to 2 years, but then after that, we just have to gently find out and try to make the child feel confident, and they will slowly come off it.
Dr. Murugesan, you mentioned about breast feeding during your presentation, that it is very essential to do it within an hour of the child's birth. So in what happens in the C-sec cases, like are the mothers able to feed immediately within that time span?
Yeah, yeah. So this is also a very important topic because in C-section previously there used to be challenges because it is inside the operation theater. There is a lot of other healthcare professional inside. They want the mother and baby to be safe first before they can start feeding. These were the conceptions which misconception people are having. But now people have realized that it is important, so important that breastfeeding should be done in C-section. So it is everybody's job. The obstetrician who is there doing the C-section, the pediatrician who is there to receive the baby, the anesthetist who is there to help the mother go through the process of C-section. So they all should plan before that, and also the mother and the father or the parents, they should ask for it. So I want to breastfeed the baby even after I'm undergoing C-section. So it's a joint effort. So now we try to do that. So it often takes extra effort. So one more person has to stand by the side of the mother because mother sometimes may not be fully aware, fully conscious. So it takes extra effort, but it should be done and it is possible. And I know that Naruvi hospitals, they are doing that. So they are initiating breastfeeding even in C-section, and we are also doing. So despite having a high patient volume load, we are trying to initiate that. So it is important. So it is possible and it is important, and every mother should ask for it also.
So what causes formation of lumps in breast while breastfeeding, and how to manage babies who are very rough on the areolar area or they have a strong bite while breastfeeding? How can mothers prevent the pain?
Yeah, so again, a very common problem. So we try to emphasize on something called as good attachment, right? So whenever your babies are breastfeeding, so we have to ensure that they are not just feeding on the tip of the nipple, but instead on the black area of the which surrounds the nipple. We call it the areola. So we should ensure that the baby grasps the areola, just not feeds on the tip of the nipple. That is known to cause pain. So what happens is, so after some time, your baby might keep on biting on the nipple and cause something called as nipple sore. So it is very painful for mothers. And the other thing is, baby biting on the nipple may not lead to sufficient milk output to the baby. So what happens is the breast milk gets clogged. So you will probably develop a breast lump also. So it is totally related to baby not getting adequate milk, probably due to some difficulty the baby is facing to grasp the areola adequately and suck. So if you have problems, you ask your doctor, you ask your pediatrician or obstetrician, or lactation counselors are also available these days. Nurses are very excellent tutors in this aspect. So get the help of somebody, ask them how it is done, and you will definitely be able to overcome this. But I agree that during the time when baby is biting, it is extremely painful for the mother. Yeah.
Yeah, Aishwarya is asking whether the BMI calculation for children and adolescents are same as the adults. She says, my son is 170 centimeter tall and 70 kilo weight. So is it normal? He's only 12 years old. Who would like to take that, Dr. Nagarajan or Dr. Sonia?
The BMI, the body proportions constantly changes during the entire childhood. It's not the same as an adult. The growth chart for a child is entirely different from that of an adult. So we got separate chart recommended by Indian Academy of Pediatrics, Kadilkar chart for adolescent age groups. It's good to have a discussion. The question is actually very relevant. It's very important for the parent to ask whether my child is overweight or obese. So it's better to consult a doctor as such. Many times, if the parents find it the child to be pretty healthy, if the child is little chubby, that's not the case. With the current scenario going on, increasing atherosclerosis, diabetes, and everything, not chubby child are healthy. Beyond certain age group, those things are not healthy. If the parents are in a real doubt, it's better to consult. I just gone through the question. The child is in a pretty good height, above average, 170 centimeters, and child is around 70 kg. Child may be absolutely normal if the child is more muscular. So I cannot say whether the child is normal according to few reports. It's better to have the doctor to have a look. Whether the child is more obese, that is the fat proportions are little higher. Whether the child is more muscular, I have to see the child as such. So it's better to consult the doctor.
Yeah, because a lot of time, people also say, oh, that's puppy fat and it
Yeah.
will go off once
No,
the child
it's not the
grows.
case. No, it's not the
Mm,
case.
mm. Dr. Sonia, this question again back to diet. There's a myth about milk consumption. So could you clarify on the importance of milk in terms of growth in adolescents? And also, things like whether we can give honey in place of sugar, warm water. There are these couple of people have their usual doubts.
Okay, so till 6 months, the best and only feed we say is exclusive breastfeeding. Direct breastfeeding is the best for the baby. No water, no other chemicals, uh, and nothing else is required because the mother's milk has enough water and everything the baby needs. After 6 months, the milk is not enough, mother's milk. So then we start the complementary feeding. As I said, nowadays all foods can be introduced one by one. Once in 3 days, we can change the food and see if the baby has allergy or any problems with that food and continue introducing wide variety of tastes. The milk. So the milk, I always say that the milk which we get other than mother's milk is not the mother's milk, cow's milk. So as part of a balanced diet, milk can be there. Like the milk can be given once or twice a day. Maximum a child can have a 200 or 250 ml. But milk is not the only food. The milk doesn't have the vitamins and other things for the growing child. So, as I showed in the picture, half the plate should be rainbow colored food. Milk is just one part of the meal. So, and bottle fed babies drink so much milk that they are not hungry, and that also leads to deficiencies and obesity. So, that's.
Yeah. So Nelia K is worried about huge hair fall in her 5 months old child.
Babies, newborn babies and babies, their hair and skin, as we do the oil massage and bathe, they will be having some amount, the old hair, old skin may be falling off, but with good nutrition, they will all grow back. So we have to just monitor and see. If there is any problem, child is not growing well, then the doctor will advise supplements if required.
Yuvang Chaudhary is talking about his 8-month-old son who cannot control his head, due to which he is not able to sit on his own. What should I do for this development delay?
At 8 months, the child should have the neck support, and the baby should be uh, able to sit on the lap. And if there is no head control, they should see the pediatrician, and the pediatrician will advise and maybe refer for developmental assessment and other exercises, physiotherapy, which the child may benefit for, or other reasons may be there which has to be investigated.
And also Lakshmi Karthik is asking that we doctors are advocating no sugar, no salt for a year from birth. So is that really beneficial?
As I said, the child has to learn to eat normal food, carrot taste. Putting sugar, child will always prefer sweet items. So we just want the natural taste. Sugar, honey, date syrup, jaggery, all are in the sweet category. So we want the child to learn the sweet, bitter, all the taste buds should be stimulated. So only concentrating on sweetness will cause picky eating later on. So salt also, as a pinch of salt for certain non-veg items may be given, but too much salt, their kidneys cannot manage, and that will lead to health issues. So natural food, homemade food is the best.
Weaning foods. Husna is asking you to mention some weaning foods.
Weaning food. So you can start with simple cereal items like rice. Initially, at 6 months, baby needs to have in a puree form rice and then dal. After 3 days, you can introduce some vegetable. Every 3 days, we can change the menu, introduce different food groups. All the protein, carbo, every food group should be introduced, and we have to see how the child takes it. Water should be started. Baby should drink from a cup, and baby will slowly appreciate different tastes. Even if the baby doesn't like it, we have to introduce it at a later time. But we have to be little brave and give all food groups, which I showed in the picture. It can be egg, it can be meat, but it should be in a way which baby can safely swallow. Baby
What
should not
about these
choke.
drinks like Horlicks, Bournvita, Complan, and these? Are these necessary? And
These are
should
sweet
we give it
items.
to our children?
These are added because again it adds sweetness, and it is not required. The normal full fat milk for a child is providing its own calories and proteins. If the child is fussy for taste, but then it is not recommended because it's a processed item. It has a lot of ingredients which may not be useful.
Dr. Murugeshan, Madan Shekhar wants to know, how does mouth breathing affect the immunity and facial structure of the child? And if it's continued, can it be cured later as an adult?
Yeah, so mouth breathing is usually due to some nasal block, which is very common. So in some cases, there is something called tonsillitis or adenotonsillitis. So children who frequently develop URI, they may develop something called as adenoiditis or adenotonsillitis. In those conditions, they may have some growth problems because of chronic mouth breathing. So if it is there, they will usually have snoring also. So it's in addition to mouth breathing, right? So they may have growth problems also. So if there is a suspicion of something like that, then you need to get evaluated by a pediatrician. So he may ask you to see a ENT specialist, after which you will have to address that adenoid problem. If needed, a surgery may also be needed.
Right. So I think I'll have to close the program because we have overshot our time. I'll end with one question to you, Dr. Nagarajan. Rajni is asking that, however hard we parents try to be the role model, children are following their own way. So what
That-
should we do?
that is meant to be happen. We are not going to make Xerox copies of ourselves. They should have their own unique behaviors and everything. That is the concept behind it, and they should mold into a good one, and we can guide them. We can guide them by being a role model and just overlooking every aspect of their own life. We can keep in touch with the teachers. We can keep in touch with the friends. We just make sure everything is safe around them. Yeah, it is up to it's up to certain extent. It is the individual child responsibility as well to mold into a good behavior. We can provide a protective, safe environment. That is the best part of the family to do with the child.
Yeah, so thank you. There are still a lot of questions which perhaps you could later answer directly, doctors. So what we gathered is every stage in each child's life is a time of growth and learning, and adults and parents, we need to support their physical and mental well-being by modeling the healthy behaviors ourselves, which is healthy eating habits and regular exercise and good sleep. A child always is looking for love and safety, as you mentioned, and so spending quality time with them and fostering a warm and tender relationship will make them feel cared for and also lay a foundation for a happy and healthy life. So let us all together raise healthy and health conscious children who are the future of the nation. Thank you, participants, for joining in and sending your questions, which made the discussion more interesting. And thank you, Dr. Sonia, Dr. Murugeshan, and Dr. Nagarajan, for joining this episode on raising a healthy child under our 15-part webinar series of Healthy India, Happy India initiative, which is jointly presented by Naruvi Hospitals, Vellore, in collaboration with the Hindu. Thank you all once again.
Thank you.
Yeah, thank you.
Thank you. Question answers are there. Can we just answer the questions? No?
Meeting close actually.
Meeting close, question answers cannot be answered.
Should I close the webinar?
Okay.
Seriously.